How is valvular heart disease treated? Other than having regular checks on the valves, many patients with valvular heart disease require no treatment. It is very important to be aware that any heart valve that is abnormal is susceptible to infection. This rare but potentially dangerous condition is called endocarditis. To reduce the risk of this infection, ensure that your teeth and gums are healthy. Tell your dentist and doctors that you have a heart valve problem. If appropriate, they will then give you antibiotics before any treatment being considered. Patients will usually have a yearly checkup. Even in the absence of symptoms, this is important so that any potential problems can be detected and treatment started in the hope of preventing symptoms. Medication may be necessary to control symptoms. Diuretics, commonly known as water tablets, help the body to lose salt and water through the kidneys and help relieve the build-up of fluid. ACE inhibitors act by dilating blood vessels in the body. By doing so, they reduce the work of the heart each time it pumps blood into the circulation. Unfortunately, not all patients are suitable for or able to tolerate ACE inhibitors. Digoxin can be useful for patients with irregular heartbeats to control the speed of the heart. Beta blockers slow the speed and the force of the heartbeat and reduce the heart's workload. When the mitral valve or pulmonary valve become narrowed, it is sometimes possible to stretch the valve with a balloon introduced into the circulation from the groin. This procedure is done under local anesthetic and is known as Valvuloplasty. If medication alone is not sufficient to control the symptoms from a leaking or narrowed valve, surgery may be needed to replace or occasionally to repair the damaged valve. If surgery is needed, you may be advised to have this done before any permanent damage to the heart occurs. This can be a very complex decision. It may even be advised at a time when you are experiencing very few symptoms.